In this world of competition due to unhealthy eating, stressful life and unhealthy living habits, people are suffering from hormonal problem and thyroid is the most popular one. To know what are different thyroid problems and how to manage your thyroid problems with the dietary modification, watch this video till the end. If you still have not subscribed my channel, please subscribe and press the bell icon to get latest updates from Life. Hello friends, welcome to Life. I am Dr. Seema. I make videos related to food and nutrition. Today I am going to talk about thyroid disorders and how to manage thyroid disorders with dietary modifications. Thyroid is butterfly shaped gland along the front of neck wrapping the trachea. It is smaller in the center with two large wings around the side of the throat. Thyroid is an endocrine gland which produces thyroid hormone. Thyroid plays an important function in your body of releasing and regulating thyroid hormone. Thyroid hormone is important for regulating metabolism process. So, what is metabolism process? Metabolism is the process in which the food you are taking into your body is converted into energy and that energy is utilized by different body cells for normal bodily functioning. Thyroid, which functions normally, produces 80% of thyroxine hormone and 20% of triiodothyronine hormone. Thyroid glands also produces little amount of calcitonin hormone, which is important for regulating the calcium levels in the blood. Some of the most common thyroid disorders are hyperthyroidism, hypothyroidism, goiter, thyroid cancer, thyroid nodules and thyroiditis. Thyroid disorders may develop at any age and the cause for development of this disorder could be illness or dietary deficiencies. Goiter is a condition associated with the abnormal enlargement of thyroid gland. It is generally painless, but if the goiter is large, it may cause cough and may cause difficulty to swallow food and breathe. Causes of goiter are hyperthyroidism, hypothyroidism, nodules to thyroid gland, thyroid cancer, pregnancy and inflammation. Lack of dietary iodine may cause goiter. Goiter are more common after age 40 years. A family history of autoimmune disease increases the risk of goiter. Females are more prone to goiter and other thyroid disorders. Pregnancy and menopause may cause goiter. Some medications like hard drug amiodarone and psychiatric drug lithium increases the risk of goiter. Exposure to radiation may cause goiter. Hyperthyroidism is a condition associated with the excess secretion of thyroid hormone, and the most common cause of hyperthyroidism is Graves' disease, which is a immune system disease. Hyperthyroidism causes faster metabolism. Due to increased metabolism rate, person may suffer from weight loss, eating more than usual, faster heartbeats, anxiety, nervousness, feeling irritable, facing troubles for sleeping, shaking hands and fingers, increased sweating, muscle weakness, diarrhea, disrupted menstrual cycle, changes in eyes like bulging of eyes, and osteoporosis. Hypothyroidism is condition caused by insufficient secretion of thyroid hormone. This condition in infant is termed as cretinisms, which has very serious side effects like abnormal bone formation and mental retardation. Hypothyroidism causes fatigue, dry skin, constipation, more sensitivity to cold, weakness, slow heart rate, depression, memory problem, and weight gain. Thyroiditis is an inflammation of thyroid gland due to abnormal functioning. This inflammation can cause the death of thyroid cells, and death of thyroid gland cells cause insufficient thyroid hormone secretion. Due to insufficient thyroid hormone, body's metabolism also impairs, and there are 5 different types of thyroiditis. Thyroid cancer is a very rare condition. The symptoms of thyroid cancer are hoarseness of voice, neck pain, and enlarged lymph node, trouble breathing and swallowing. Thyroid nodules. This is very common condition. Mostly the nodules are benign in nature. The first reason for developing any disease or disorder is poor diet. It's very important to follow healthy eating and living habits to avoid disease and disorders. Healthy dietary intake is very important for proper functioning of thyroid gland. The synthesis and use of thyroid hormone can be impaired due to the insufficient or poor dietary intake. Thyroid can also be affected by stress. There are so many reasons of stress in everyone's life, like jobs, interviews, never-ending course, money issues, family issues, and stress reasons we cannot control. But we can definitely control our diet. Adopting healthy eating habits will definitely make you feel better. And with healthy eating and living habits, you can manage your disease or disorder very well and can lead towards a normal life. So let's get started with the dietary guidelines to manage thyroid disorders. Nightshades vegetables like tomato, white potatoes, eggplants, bell peppers should be avoided. Nightshades are family of plants known as Solanaceae. These vegetables are good sources of vitamins, minerals, antioxidants and promising many health benefits. But they are containing molecules like lectins and alkaloids which are not good for health. Lectins from nightshades vegetables can bind to the gut and disturb the good bacteria, obstruct the digestion of food, and disturb hormonal balance. Some alkaloids are useful, like morphine and quinine. Some alkaloids taste bitter and, if swallowed, are mildly poisonous. The intestinal barrier that can cause digestive problem is affected by alkaloids. Such effect on gut can result in continuous poisoning and inflammation. Continuous long-term consumption of nightshades can damage gut, and unhealthy gut is the root cause for developing autoimmune diseases. Avoid onion and garlic, as onions and garlic are goitrogens. It can affect thyroid gland functioning and cause enlarged thyroid. Onion and garlic should be avoided in hyperthyroidism. Vinegar should be avoided. Vinegar contains acetic acid, and acetic acid stimulates the thyroid gland to pull phosphorus from the adrenal gland to negate the effect of acetic acid in the system. Depleted phosphorus results in the impaired function of the adrenal gland. Red meat, pork, and processed meat should be avoided. Red meat, when cooked at high temperature, it generates some chemical compound like heterocyclic amines, polycyclic aromatic hydrocarbons, and N-nitroso. These compounds are carcinogenic. Mushrooms contain good amount of selenium, which helps the synthesis of thyroid hormones, so it should be avoided in hyperthyroidism. Aged cheese like American cheese, blue cheese, gorgonzola, gordula, camembert, Swiss, Fontina, Roquefort, pepper jack, and many other cheeses that have been aged and have lost their water content, so it's hard to digest and can cause gut illness. Soya products should be avoided. Soya is a goitrogen food. It can prevent the thyroid hormone production and causes enlarged thyroid gland. Other goitrogens are broccoli, cauliflower, cabbage, bok choy, Brussels sprout, kale, radish, and wasabi. Seeds like chia seed, hemp, and pumpkin seed should be consumed in less quantity. Processed and packed beans products should be avoided. Cold dairy products should be avoided. There is a lot of fat in dairy products and it's hard to digest if consumed cold. Heating will make such fat more digestible as cooking breaks down the heavy fat. Pulses are the best sources of proteins. Green lentils, French beans, red lentil, green gram dals can be included in the diet. Non-vegetarian people can include chicken, fish, lamb in the diet. Grains, brown rice is hard to cook and digest, so it should be avoided. White basmati rice, millets, oats, quinoa, amaranth, barley and rye can be included. You can include all vegetables in your diet except the cruciferous vegetables like cabbage, broccoli, cauliflower, kale because these vegetables contain sulfur and are potential goitrogens. Dark green leafy vegetables like spinach contain more oxalic acid, which can deplete the minerals like calcium and magnesium. But cooking of vegetables reduces or deactivates these harmful substances. It's very important to include cooked vegetable in your diet. Cooking softens the fibers, allowing for greater absorption. It's good to cook vegetables with ghee or oil because fat helps to enhance the absorption of nutrient across the cell wall. Do not need to completely avoid raw vegetables. Should eat little portion of raw veggies per week. All fruits are allowed to consume. Fruits digest and absorbs quickly, so it's best to eat fruits. But sugary fruit juices and canned fruits should be avoided. Animal fats like lard, butter should be avoided. Ghee is the best fat to consume as it is rich in omega-3 fatty acids which can help to decrease the level of unhealthy cholesterol in our body. It is also a good source of butyric acid which helps to reduce inflammation of gastrointestinal tract. It also helps to grow good bacteria in gut. Ghee also contains conjugated linoleic acid which prevents inflammation in arterial wall and hardening of arteries. Coconut oil, unrefined sunflower oil and olive oils contain monounsaturated heart-friendly fats, so it's good to consume it. Boiled milk is always recommended. Never drink milk with fruits and vegetables. Consume it with grains, dried fruits, nuts and spices. Sweeteners to avoid. Agave nectar, artificial sweeteners, high fructose corn syrup and sucralose should be avoided. Sugars to be included in your diet. Blackstrap molasses, which is rich in iron, copper, magnesium, selenium, vitamin B6 and calcium. Coconut sugar, which contain polyphenols, iron, zinc, calcium, potassium, antioxidants and phytonutrients, which is extracted from the sap of the bloom of coconut palm. Date sugar, natural brown sugar, maple syrup, raw honey and stevia can be included in the diet. Follow some guidelines to eat nuts. Soak almonds overnight and peel off the skin before consumption. Sesame seeds should be lightly toasted before consumption. Limit eating cashews as they are hard to digest. Eat handful of nuts at a time. More than that is not recommended. Avoid eating nut butters. Consume nut milks. Wake up at the same time every day. Follow fixed breakfast, lunch and dinner times. Never skip breakfast. Try to avoid stress and stay happy. Thanks for watching. If you found this video interesting, hit the like button, leave your comment. Don't forget to subscribe and press the bell icon to get latest updates from Life. See you next week. Bye.